So we're here with Avanti Derma's patient coordinator Ian. Oh, hello, Ian.
Hi, Luis. How are you?
Hi, very good, thank you. So your job is basically to what?
Well, it's separated in two things. The first one is coordinate the appointments for the patients and their transportation to the clinic and make sure that we have everything they need here in the office. And the second part is to assist during the procedure, to be in charge of the aftercare, and to make sure they go home happy and healthy as they came here.
How do they contact you, through email or Zoom calls?
Uh, it varies. They typically contact us through the web page and send a request for our information. Once we establish the communication with them, we just continue through either emails, Zoom meetings, or over the phone.
Okay. And what are the places do they contact you from? There's a website called the Phalloplasty.
Yes. There's this forum on the internet called phalloplasty, and they mostly meet there. Like most of the guys find information about these kind of procedures through that forum, and the ones that want to get to know us contact us directly through either the email or over the phone, or they just request a Zoom meeting. And well, there's people from all over the world. We had patients this week from I think they come from Ireland. We have one from Ireland this week, and the last week we came. There was this guy that came from Egypt.
And what are the common questions you get from those people that text you or email you from Phalloplasty?
Well, how much they can grow, how many sessions they will need, and what is the filler that we use.
And for, let's say, because I remember a patient you had recently, he was like 21 years old. He's pretty young, but he wanted to do it. He was scared of doing it, didn't know how many cc's does he need. So what's the best approach to start?
They need to know and understand that there's certain volumes that the doctors here at Avanti Derma recommend for each patient, and depending on the kind of filler they ask, because we have permanent, non-permanent, and long-term fillers. So depending on the type of filler they want to get, it's the recommendation that we're gonna give.
And for example, if one wants to have a PMMA, that would be the permanent one.
Correct.
Yes. What's the best doses that you recommend? Or
it's an average of 20 cc's that the doctors here at Avanti Derma have been recommended from the beginning when they started doing this procedure. But obviously it varies from guy to guy, depending on length, depending on the sessions they have undergone already. If there's the first time, if they're circumcised or uncircumcised, but it's an average of 20 cc's.
So 20 cc's is the safe spot.
Yes,
for everybody,
one session,
one wants to start. And do people come for more sessions afterwards, or it's rare?
Yes, they do come because they love it, and sometimes they are looking for an increase of 1 inch, and obviously with one session we can get you close to it. But if they're looking for more girth, they come for second sessions, third sessions. Obviously there's always a limit, and we here recommend at least 2 full sessions to get them close to 1 inch, 1.25 inches, probably 1.5 inches, and a touch up if there's any irregularities or aesthetic issues they'd like to address.
What is a problem that patients could have, not of doing it, but before doing it? Meaning, what are some patients that could have problems with doing this, like circumcised patients, uncircumcised patients?
Oh, okay. There's obviously regulations that we have in order to provide like the best possible outcome. If a patient is non-circumcised, it has very tight skin, or it's being treated previously by other doctors with different fillers that are not compatible with either PMMA or with Elance or hyaluronic acid. Let's say if they have like silicone or other fillers that are not the ones that we use here, they can encounter themselves with some issues that might develop after our sessions.
What are the most relevant use of fillers at Avanti? What is the most relevant use of fillers? Is it the face,
Well,
The
the number one here is the girth enhancement. It's a penile girth enhancement that it's the most that we do here. It takes most of our days all over throughout the year, and then faces for just make them more masculine or feminine, or to treat lipoatrophia from patients from HIV. I think I remember that's how phalloplasty at Avanti bioplasty at Avanti Derma started. But now I think that's not very common anymore because HIV medication does not cause hypertrophy anymore. But we still do that.
So Avanti Derma started by helping HIV patients with their facial reconstruction to with
Yes,
those type of fillers.
that's how it started. When I started here, probably 7 years ago, and they were already doing this. So that's how they introduced me to this world.
So basically, you were using cosmetic practices to make people feel better.
Yes. It sounds like cosmetic, but it was more like miraculous work, because I witnessed a couple of procedures that Dr. Casavantes and Dr. Morales did with these patients, and everybody was so happy and so content they started to cry. So it was very emotional to be able to help people in this situation.
For example, you say non-surgical. Well, do you still do the procedure for HIV patients? You said no, right? Because you still do
Dr.
it, but there's
Morales
no
can still
need.
do it, but there's no much demand because it's not that common anymore.
No, right. And what about the non-surgical phalloplasty that you mentioned, girth enhancement? Can you describe us what is non-surgical versus the surgical phalloplasty?
Oh yeah,
Yeah.
it's non-surgical, meaning that it's an outpatient procedure. You just come in and go. There's no any surgical instrument. Dr. Morales uses a cannula just to be able to place a filler around the penile shaft, and that's what makes it not surgical.
And so it's a less aggressive procedure.
It's way less aggressive. It's probably 45 minutes up to an hour and a half, depending on the patient and depending on how things are going throughout the procedure. We are talking to the patient. He's awake all the time. It's not non-aggressive. Very few bruises and a little bit of swelling.
Around, well, how much time do they recover usually?
It takes about a week, 2 weeks for the swelling to go down and for the bruises to go away and for their entry points to close.
What does the aftercare look like on a regular basis?
In general, first of all, to prevent any kind of infection, to keep the entry points closed and clean and make sure that they are dry. The patients need to perform this kind of molding and massaging techniques to make sure that the filler stays in place, because the penis is very dynamic organ and it will be retracting and having erections, so it will misplace the filler throughout the first days. So it's very important that they do mold and massage their penis to make sure that everything is in place.
And when they say they have a choice between three different options, permanent, long-lasting, and non-permanent, what are those three choices? What is each product mean, or
Well,
how is it called?
we have the permanent, which is the most popular filler that we use here, and this is recommended when the patient has no questions about committing to something on the long term, that they did the research, that they know everything they need to know about this procedure and the filler, and be conscious that it's gonna stay with them forever. And to remove it, it does requires a surgical procedure, which is very aggressive. So if they're not sure that they want to commit to 100% to this filler, we push them to either Elance, which is it gives and provides pretty similar results as PMMA, with the advantage of that it's going to be there only for a couple of years. And obviously it's way better than hyaluronic acid, that provides kind of like a sponging feeling, and it's only gonna last like around a year or less than a year, depending on the brand, depending on the metabolism, depending on many factors. And price wise, it's kind of, they are pretty similar between Elance and hyaluronic acid. PMMA, Linea Avanti, speaking strictly of the filler that we use here, it's cheaper. And that's also a factor for people to go for PMMA instead of Elance or hyaluronic acid.
So the permanent right now is the cheapest option. Then
Yes,
in price
it's
because
cheapest.
it's been
And
around.
in my experience
Yeah.
here with the results that I've seen, it's the best option that we have.
Is the best option. And what if somebody wants to start his journey on non-surgical girth enhancement? What's the best way to start this journey?
To begin with, if they're willing to come to us, just ask for our electronic brochure, and there's plenty of information there, basic information that they need to know before moving forward. It explains about volume. It explains about how the procedure is done, what aspects can disqualify you as a patient, what are the best conditions that we need you in to be before getting the procedure done, and many examples throughout our picture gallery that we have there too.
And around how many patients have you had this year in 2024? Or maybe
Well,
let's
we're-
just go 24, 2023.
I think it's easier for me to let you know how many having this year, because we're only 3 months out of the year, and it's being around like 45 to 50, the ones that I have in my mind. So last year probably was like, I don't know, 200 and something.
45 patients in just 3 months.
Yes.
Wow, you've been busy. And what about around those 45? How many? The majority are doing the permanent, Elance or hyaluronic acid.
I dare to say that like probably like 70-80% of our patients choose the permanent one, and the next one is Elance, the long-term filler. And incredibly, we have had a couple more of patients that have chosen hyaluronic acid this year.
How do they feel? The patients usually when you hang out with them, do they talk? Is it quiet?
At first, they are nervous, and once they have filled out their intake form, their consentment, and once we take them to the room, they feel a little bit more relaxed because we make them feel like they're comfortable. Because otherwise, it will be a very long 2 hours for us to work with an anxious patient.
And during the aftercare, do they stay here for a couple of days, or do they go back and you
Yes,
contact them?
most of them, well, to all of them, we recommend them to stay at least 1 night or 2 nights if it's their first time here. But I always push them to stay longer. That way, we'll be able to see how everything's going on the first days after the procedure, and take advantage that they're here, because we know we are in Tijuana, located in Tijuana, and they come from the U.S., they come from other countries, other continents. So it's important for us that they stay here, and we can make sure that they are developing in the way that they should.
You're located in Tijuana, and you've had 45 patients from the U.S. and from other parts of the world.
Yes.
How would you describe Tijuana for people who haven't come here? That they say what's the best perspective around? Because I like it. I see it, and I really like the area where you are.
Yes, I mean, I was born and raised here in Tijuana, and for me, it's a really great city. It's been developing, and it's turning into this cosmopolitan city. And the place we're located in, it's pretty nice. It's the food district, and the most beautiful thing about Tijuana is that it's a mix of a lot of cultures, and there's a lot of art, food, and people from different parts of the world living here, not just coming for these kind of procedures. They actually live here.
And the clinic has the hotel right next door, right? It's close on the they're joined together. So they never leave the building. How
Yes, for those who are afraid of like traveling around the city, transport, going from one hotel to a clinic, the advantage that we have is that we're located next to the Grand Hotel. We're located in a 2-tower complex, and they don't even have to leave the building to get to our office.
And how much do they walk? Just
Like 2 minutes.
like 2 minutes.
2 minutes plus the time that the elevator is gonna take to.
And
to
you
go
guys
down and
arranged the whole thing about the hotel arrangement, the appointment, and the.
No, we pass them information about the hotel, and they have a special rate because the hotel front desk or the reservations department is gonna ask the patients for their cards, numbers, and personal information. That it's better if they just do that.
Oh, okay. But they get a discount.
Yes, they do get a discount, a special rate for Avanti Derma's patients.
And you mentioned that you were in contact with them through email. How do you handle their transport? From the San Diego airport?
Yes, we have a couple of companies that once I know their itinerary, if it fits under the transportation schedule for their working hours, they pick them at San Diego airport or near the area of the San Diego airport or near the border, because that's the limit that this company have to pick up people in San Diego.
It's a shuttle service.
It's a shuttle service, yes. And recently there's this new driver that can be able to pick patients on Sundays, because some of the flights are cheaper on Sunday and they come here after hours. So our regular shuttle service doesn't work at that time.
Yeah.
So this guy can do the pickup on Sundays or after hours during the week.
So they can get a shuttle service that pick them up at the San Diego airport. And what happens?
Oh, they pick them up at the airport or at the location they provided us in San Diego, and they just cross the border in the shuttle. They bring them either to the hotel or to our office, and the ride is about 45 minutes depending on traffic.
Oh, okay. And to go back, do they take them back?
Yes, we also have that service too. They pick them either at the clinic or the hotel. Sometimes they go very fast because they can get into special line, so the waiting time is less than if they just come here and take an Uber to the border and walk across the border, and it's easier, safer, and really easy.
And you get a lot of messages for aftercare with all the patients that after they've done their PMMA or their Elance or their hyaluronic acid, you get a lot of emails of how to proceed with the aftercare. What is something that you would like to just said to them, because maybe a lot of patients don't get it, and you see a common thing happen through the emails like, hey, I'm scared of this, what am I supposed to do about this?
To begin with, that it's gonna get swollen because of the procedure itself, and because of the aftercare, it requires a lot of manipulation, manual manipulation, so it's gonna get swollen. The most common question right after the procedure the next 2 days, because they either can text me or email me. So if it's over text, they are, obviously they're scared and freaked out because their penis turned out purple or red, or it's all bruised and it's all swollen, so they get scared. So I just let them know that they should stop manipulating as much, because they still have time to make sure that everything is in place, and to keep everything dry, to make sure that they are taking their medications that we provide to them. Ibuprofen is among the list, and that's going to help them to reduce the swelling. Also, we have a package that includes a set of lights that's going to help them to reduce swelling afterwards. So we do that too. And yeah, that's the most common. Other common questions are like, after the swelling goes down, because of the process that it is explained in our brochure, they feel like they lost all the gains they got right after the procedure, but in reality, it's the collagen that's working and forming throughout to surround the microspheres of the PMMA, and that process lasts around 6-8 weeks. So by the second week or the third week after the procedure, they just contact me and say, hey, I lost everything that I gained. Where's my money? Where's my filler? And it's like, just wait. It's a process that you have to let finish before you can. I don't want to use the word complain, but before you have your final judgment about the procedure and the results.
Let it sit through 6 to 8 weeks.
Yes.
And I'm pretty sure they get the question a lot. how long till they can have sex again?
Oh, I forgot about that question because it's so common that I just evaded. It's a minimum. We ask a minimum of 15 days just to make sure that the entry points are closed, that the swelling went down. But I mean, the collagen formation process lasts 6 weeks, so I always recommend to wait those 6 weeks. I know for some guys it's very difficult to wait that long, but if you wanted to put the best effort to get the best results, just wait that long.
Because what happens if you have sex?
Well, they're gonna because of the friction. There's gonna start another swelling process because it's gonna get swollen again. They're gonna be very sensitive. If they have sex right after the procedure, I mean, there are entry points open, and they can get an infection. They can misplace the filler because it's still fresh there. So just wait at least 15 days.
Yeah, yes. So it's a month and a half would be the safest one, but 15 days.
It will be the best, yeah.
Yeah, that would be the best. Really good. And what about for Elance and PMMA? What are the benefits of doing Elance versus PMMA?
Well, the benefit is that it only will last for a couple of years in case you are not, or the patient is not convinced to get it permanently done, because I mean they're committing to something that's permanent, and there are things that you have to take into account, and if they're not 100% sure, the best option is Elance because it promotes collagen growth. It works pretty similar to PMMA. And the advantage of, as I said, of Elance, it's that it will last 1 or 2 years depending on the version they get, because we have 1 year version and 2 years version.
What's the size of a regular patient's penis that comes here? Some people may think that short penises are your most frequent patients, but
actually not. It's an spectrum on sizes. But the average that we have here in the flaccid state before we pull it back, it's around 12 to 15 centimeters.
Around that. And what's for Elance, how many cc's do you ask them for? Is it, again, the 20 cc's?
No, we require less. And also, it depends on the length and the type of skin that we can appreciate from the pictures that we ask our patients to send us. And it can be from either 8 to 10, 12, even up to 15 cc's.
And afterwards, do you do like Botox too, or on the face, or what does other services Dr. Palmira
even though girth enhancement is the #1 procedure that we do here, Dr. Morales works on face enhancement. She does Botox, lips, jawline, chin, temples. She does platelet-rich plasma for the face, for the hair growth. Yeah, all kinds of cosmetic procedures.
What about the scrotal enhancement?
Oh,
what's that about?
Scrotal enhancement, it's the voluminization of the scrotal bag. For this, we do not use permanent fillers, only hyaluronic acid, because it's the safest way to get them enhanced. And for that, typically, in order to see a good augmentation or a good difference, we require around 6 to 10 cc's per side.
Do you have
depending on how much they wanted to expand.
Because I saw that you had a promotion on that, on scrotal enhancement.
Yes, we were able, because since we're using hyaluronic acid and it's an expensive filler, getting that kind of volume or big volumes, it's very expensive for this procedure. We were able to find this hyaluronic acid that works perfectly for the scrotal enhancement, and the cost is not that elevated.
Mm-hmm. For the next, if somebody did the procedure, either Elance or PMMA, and did the 20 cc's, when they come back, how many cc's do they ask usually?
Oh, well, if it's with PMMA, it's the average 20 cc's, but sometimes Dr. Morales is only able to use 15, 16, 17, 18, 19. Sometimes she requires more, like 22, 23, even up to 25. So we do that we go in that range. And for Elance, it's typically the same amount. It's either it's what we recommended the first time. If they want to go to have growth all over the shaft again, it's probably around the 10, 12, 15 cc's, depending on their length. Or if they just want to work on certain areas that are lacking volume, well, it will have to go 4 or 5 cc's just to cover certain areas.
What have you seen around the patient's partners, love partners, wives, and all? What should they be aware of? Should they talk to them beforehand? Not
Well,
tell them
yes.
this?
If they're married, obviously they should disclose this, because especially if they're going to commit to a permanent change in their bodies. Because we have had patients that had to get it removed because their partners weren't so thrilled about this, and they wanted it
Because it was too big for them.
because it was too big, or because it was causing it was an issue on their marriage, not sexually but for divorce or something like that, so yeah, I remember now that you mentioned that, because it was too big. I remember 2 patients that had it removed because they went over the limit and got huge penises.
But when you say they went over the limit, you meant like 40 cc's?
No,
Like
I
that?
meant like, as I said previously, we recommend 2 full sessions and a touch-up, and there are patients that come here for those 2 sessions and then go to another clinic for another 2 sessions, and then to another clinic for another 2 sessions. So, like, that's too much, because we're talking here of a growth like from half an inch to 3/4 of an inch per session. So that's going a little bit too much over the...
So but basically 20 cc's is a safe spot for everybody who wants to get big, and they'll see it and
And have realistic
That's not a
goals.
usual measurement where people get a divorce. That's what
Yeah,
I meant.
no, that's not.
They're safe with that.
Yes.
It's okay.
For divorce issues, it'll be like 4 or 5 sessions,
Oh, okay. That would-
especially if they did not disclose that to their partner.
right. Okay. What about what shape do you help them with? Hey, I want this shape, because some guys want bigger.
We always we always hear the patient and their needs and their goals, but there's only so much that the doctor can do in shape wise. So we have had requests where they want to get like a thicker neck, the area near the glands, or a thicker base, but sometimes their own anatomy does not allow us to help them in that way. But when it is possible, Dr. Morales does it.
What about the balls? Do the balls, do they get bigger, or do you have something to get bigger?
The testicles, no, we do not have something to make them bigger. The scrotal sac, yes, with the scrotal enhancement, but I know there are solid implants for the testicles that do make them feel better. But I think that's something that you need to do surgically. I'm not so sure about that. So
Right.
yeah.
And what about the glands? The glands enhancement.
For the
Themselves.
glands, we have a safe procedure that is also done with hyaluronic acid, and it only involves the corona of the glands, which is the edge. It gives a little bit of projection. It's not such a big change because trying to add filler into the glands, which is connected to the bloodstream directly, it can get clogged. The patient can get necrosis. With hyaluronic acid, the doctor can apply hyaluronidase to dissolve it and prevent the necrosis, but we'd rather go on the safer route, and it's just on the corona.
Okay. And you only use hyaluronic acid, right? Because
For that area, yes.
yeah, because it's very sensitive.
Yes.
It's the safest. And when you are at a Zoom call, what's the usual conversation you have at a Zoom call?
If it's gonna hurt, if how much of a change they're going to experience. They talk about pricing, about the different packages that we have: the basic, the signature, the Atmos. If it's gonna, I already say that if it's gonna hurt, if they need to be sedated, if they need to, if they can work or when they can resume their activities, if they need to take time out of work. It's not necessary, but I always recommend them to do, because then in that case they can apply themselves to the aftercare.
Mm. What about with the topic of if it hurts? So what do you feel during the procedure?
Well, I haven't had it done myself, but I'm pretty sure that it's gonna feel sore and it's gonna be swollen. There are patients that are very sensitive, so it does hurt them, but the majority of them, they just get out of the office walking regularly.
So basically just the like if a little touch on the with the anesthesia and that's it.
Oh yeah, Dr. Morales blocks the nerves with some lidocaine, and after that it doesn't hurt. It's only for a few seconds before she starts working. But yeah, it's only for a few seconds while she's numbing it.
What about the packages? The packages that you have, what's the...
Yeah, we
usually
have here 3 packages. The basic, which is only the girth enhancement and the medication and the aftercare kit that we provide you. Then there's the signature that comes with the highly recommended PRP, platelet-rich plasma, for healing purposes and to promote a better quality for the collagen that's going to grow, and it's going to make their penises thicker. And a light, an intense pulse light that also it's a collagen booster. And then we have the Atmos, where we include all of the procedures that we do for the male genitalia, which are the girth enhancement, glans enhancement, PRP, phallotox, scrotox. Those are Botox. Those procedures are Botox injected into the penile shaft and the scrotal sac to make them relax so they don't retract, and is highly helpful. And it also comes with the LED and the intense pulse light, which are meant to reduce swelling and to boost the collagen production.
Okay. Well, thank you very much for your time, Ian.
Welcome.
This was Ian, Avanti Derma's patients coordinator. Thank you for all of you guys. If you have any questions, please leave it at the comments. And thank you for your time too. Bye-bye.